This is Scott Porter, and I am the Senior Director of Channel Development with ECRM, and I'm on the Pharmacy and Medical Markets team. I am joined here by Tim Safley, who is the Director of Specialty Programs with the Accreditation Commission for Healthcare, or ACHC, and we are in San Antonio, Texas at our Specialty Pharmacy EPPS, and really appreciate you being here. Thank you.
Thank you for having us.
And just wanted to take this opportunity to learn a little bit more about the accreditation process, why it's important, what the process looks like, and what as specialty pharmacies gain accreditation, what that looks like going forward, and why it's important.
Well, thanks, Scott. I think one of the things that we deal with most is anybody getting coming new into the specialty market. It's kind of like a starting barrier. Let's make sure that all companies that are coming in are accredited. I think a lot of payers and PBMs are looking for that just to kind of set the bar at one level. Hopefully, most of our accredited companies are setting the bar much higher than even what we ask for. And most of the time we see that. But nonetheless, it kind of sets standards of what we're looking for to actually distribute these limited release drugs.
Yeah, it seems like a lot of folks that probably PBMs, payers, manufacturers, are really utilizing this as a benchmark for who they want to work with and who's really engaging with the patients and has the correct procedures in place. Why do you think that is so important, that accreditation piece, and again, which group do you think is really driving that the most? Is it the payers, or?
I think it is the payers, but really what has been very interesting at this conference, as well as the National Association of Specialty Pharmacies, NASP conference that we hear, is that a lot of the pharmacies are coming to us and they said, originally we dreaded going through accreditation because it's so laborious, it's expensive. We're looking at ways to cut costs, not to gain costs. So, but what it's done is actually raise the level of care to our patients. And ultimately, one of the things that's missing in the pharmacy world, I won't say missing, but one of the things that you hear less and less talked about is the patients. Mm-hmm. At the end of the day, every time we set a standard, it needs to be about how do we better the care of the patients that we serve. And any time that we're able to do that, everybody benefits, because if we're treating the patient, they might have lower comorbidities associated with what's going on in their disease state. And so it's treating the overall patient and taking a look at it. And when you're on these very, very high expensive cost drugs, then looking at the overall patient for care is certainly beneficial.
And for some of these newer specialty pharmacies that understand that they need and have a desire to get accredited, are there certain standards that and processes that they already need to have in place before beginning the accreditation process?
Well, it's according to how long you want to take to get accredited. So the answer is yes, because it's when a new pharmacy comes in, it's like, well, you have to have certain standardized cares, or you have to have software to track the patient care, plan of cares that are associated with the accreditation process, but it's also associated with the care of the overall patient. So, we've seen some as early as 6 months be ready. We've seen others it's taken a year and a half to be ready, because when they're small, though, it's easier to build the policies that you need. But if you're already working in an environment that you don't have policies, now you got to create policies when you're still trying to fill scripts all day long. Yeah. And how do you break away from one to do the other?
Sure, yeah. And is it a situation where they already have their processes or policies in place and you're there to, validate those? Or is it that, hey, you really need to be doing it this way? This is what we're recommending in order to become accredited. What does that look like?
That is an excellent question. As accreditation, what it is validating a company's process and procedures for delivering either a product or a service.
Mhm.
And we're going in, we're validating it, they're meeting our standards. We kind of stay away from telling a company how to run their business. That's not what we do. They can certainly use our standards to help build their accreditation model and their business model, but it's just a stepping stone. Our main purpose is to validate the procedures that they have so they can treat the patients that they're taking care of every single day. So when they build it starting from the scratch up, using our standards to say, let's use this as a model to start building on the care is an excellent way to get started.
So Tim, you had hosted one of our thought interaction pods, and your topic was accreditation to fit the needs of an ever-changing market, and wanted to ask you what is changing about the market where you see the need for accreditation. How does accreditation change along with that?
You know, every day I think I read something about a trend of specialty markets changing as the drugs get more expensive, or even you go down the pathway of orphan drugs or ultra orphan drugs. These are huge high dollar amounts. And so now what a pharmacy has to do to deliver it is, number one, is get access to it.
Mm-hmm.
You can't deliver it unless you get access to it. So some of the qualifications, some of the things that we have seen out there that are, I'd say, barriers, is really being up with the market of what's going on with the market. And then, are you finding your own niche? One of the things that we've seen grown recently is everybody finds their niche, whether it's RA, whether it's MS drugs, whether it's hemophilia, whatever it may be, oncology, whatever it may be, they're finding niches that they specialize in. And we're seeing one of the changes now is more people are specializing in these niches than being a one-shop-all pharmacies. The downside to that is also we're seeing many payers or even plans like a Blue Cross Blue Shield or an Aetna. They like to use a pharmacy in a sense that can do everything, so they don't have to contract with 15 different pharmacies. But that's okay, or 40 different pharmacies, whatever it may be. But we're also seeing that change too, because they're finding these pharmacies that can meet the needs of their patients that have these specialized in the disease management, because they know the disease management, know what to look for, so it's not one-stop shop all the time.
Very good. Appreciate you being here.
I appreciate us coming. This is our first time here, and it's been really, we've made some good contacts, and mainly about how the business is developing for them, especially with the mixture that's here.
Oh, we appreciate you being here too. Thank you very much.
Thanks, sir.